Hi, I'm Captain Paul Sabo, and I'm the Safety and Security Officer with the headquarters of the California Cadet Corps. As part of my responsibilities as the Safety Officer is to ensure that our cadets have a safe and healthy environment while participating at this year's 2021 Summer Encampment. As a licensed healthcare provider and a paramedic in the state of California, I'm also responsible for the oversight of the healthcare administration and medical operations at our summer encampment. I wanted to talk about some of the precautions that we're taking in place this year to protect our cadets and students and staff as a result of the infection of COVID-19. Our staff worked in concert with the San Luis Obispo County Health Officer to develop and eventually approve protocols that are concurrent with CDC, state, and local guidance for the protection against the transmission of the COVID-19 virus. These protocols will be utilized during the entire summer encampment. At all times, our cadets and staff will be following these protocols to ensure that they are safe at all times and will reduce the potential of you bringing back any type of virus from the summer encampment. As part of the COVID-19 program, all personnel going to the encampment, staff, cadets, and visitors will be required to be tested. This test must be a PCR test and will be expected to be taken 5 days before encampment. The only exception to this is if a person was tested positive for COVID-19 within the past 90 days, they must obtain a clearance letter from a doctor rather than getting a COVID-19 test. All members will be screened for the completion of this exam, as well as for temperature and influenza-like symptoms prior to boarding any bus or getting any transportation towards Camp San Luis Obispo. This screening will again be repeated upon arrival at Camp San Luis Obispo to ensure that nothing has changed during the transportation process. Throughout the entire encampment, everyone will be expected to be wearing a face mask and maintain a minimum 6-foot social distance at all times. In certain circumstances, that distance will be expanded to 12 feet so that we can ensure that people are being safe. Everyone will be participating in daily screenings. These screenings will be looking for fluid-like symptoms such as fever, chills, cough, diarrhea, or other symptoms that similar to COVID-19 infection. Members will also be getting their temperatures checked twice a day to ensure that no one breaks a fever. All facilities will be regularly sanitized and cleaned routinely, and we'll be utilizing the system of bubbles. Bubbles will be basically where we take entire units, put them into small groups where they'll work independently together to minimize the risk of transmission between multiple folks that are participating in the summer camp. So what do you do if my kid becomes ill? If your cadet becomes ill, medical care and safety is our number one priority. The cadet will be tested as well as quarantined. If needed, medical treatment will be provided through the local hospital located in San Luis Obispo City, also known as Sierra Vista Medical Center. Based upon the recommendations of the health staff in coordination with the county health officer and the testing information that will be provided, the cadet will either be sent home or remain quarantined at the campsite. It is important to understand that if your cadet is asked or being sent home, you'll be expected as a parent to pick up your child and bring them home. I sincerely hope this answers several of your questions and gives you an opportunity to understand the many different things that we are doing to keep the cadets and staff safe here at this year's summer encampment. We sincerely hope you come out and look forward to having a wonderful time, and we look forward to seeing you this summer. Good luck, stay healthy, stay safe, make sure you wear a face mask, and if possible, get vaccinated. Thank you very much. Have a good day.